My breastfeeding experience was pretty difficult in the beginning. My milk did not come in quickly enough for her. I had to hire a lactation consultant. She's a much happier baby now, and I'm a much happier mommy.
Welcome to Health and Wellness. I'm Dr. Jennifer Ashton. Breastfeeding is one of the most important things a mother can do for her baby and herself, but so many women can have a hard time, myself included. So today, to share some good tips and insights into this process is well-known lactation consultant Freda Rosenfeld.
Okay, we're going to teach you how to be a sucker, but first I'm going to weigh you.
Let's start with what everyone probably has heard of, which are the conclusive health benefits to the baby that a mother can give with breastfeeding. What do you tell your clients?
Breast milk is really designed for human babies, and so you're giving them the best components of vitamins, minerals, antibodies that protect them against infections, asthma, eczema, and all sorts of long-term things, including diabetes as they get older.
Big health benefits also to the mom. We know that women who breastfeed have a lower risk of breast cancer later in life. They boost their metabolism, so they shed their pregnancy weight a lot faster. But let's talk about the nitty-gritty when it gets difficult.
Well, the first thing is, even so it's natural, it's still a learned experience. Some babies are born with tighter sucks or shallower sucks, and some moms have larger nipples and smaller nipples, and sometimes you just don't have good fits. And so you really need moms to really focus very carefully on making sure the baby's latching properly so that it doesn't hurt and that the baby can really drain properly.
How long do you normally give people in terms of time to iron out those kinks?
Right. So if it's, that the baby's absolutely not latching, you really only have a day or two, because babies have to eat, they can't get dehydrated, and you really want to get in a rhythm. If it's sore nipples, I generally say give them a good 4 to 6 days, because your initial latch might have been inappropriate and you got a little bruise, and then the two of you watched and you were like, oh my God, I didn't have the baby close enough, I wasn't holding my breast, so it was hurting, and then it could resolve on its own.
Let's talk about some specific issues that a lot of women have, and as an OBGYN, I frequently will hear these from my patients. Flat nipples is a very common one. I'll hear from a patient, my nipple just doesn't fit into the baby's mouth well, and some women bring up these nipple shields. What do you say?
So for some women, flat nipples mean nothing. You have this awesome sucker, just really knows what he's doing. I call them the speed skaters. They get on there and they're going to do it. But for other babies, not having that length can be very difficult. And so we recommend sometimes just pumping the nipple out. That will give it definition. And sometimes nipple shields are appropriate. To use them continuously without coming off, they can lead to decreased milk supply and mastitis, because there's not a good flow of milk to the baby. But if they're used what I call like training wheels on a bicycle while we're working on getting the nipple out and the baby becoming a better sucker, they could be a really nice tool to get the baby to the breast till everything kind of jives together.
Now, what about cracked nipples? What do you tell a woman with cracked
I've had
nipples?
women tell me that their cracked nipples were worse than labor. So that's, that's painful. And labor is much more finite. You're nursing for hopefully a long period of time. So the first thing you want to do is actually figure out why the baby's hurting the mother and correct the suck. Then the second thing you want to do is actually heal the nipples. And Lansano is great, but olive oil is good too. If you're bleeding, you really want to get on the bandwagon right away, because once you've cracked skin, you're much more prone to getting an infection.
So let's move into infection. Mastitis is very common.
The secret with mastitis is not to let it become mastitis. If you have a crack on your nipple, you only have to do a topical, antibiotic cream. But if you don't, that's when the infection goes into the breast and can go crazy. So if a mom feels feverish or has red splotches on their breast, they really need to call their doctor immediately.
Now, one thing that I think is drastically underutilized in terms of its effect as an aid or tool to facilitate breastfeeding is a breast pump.
We live in 2010, and I'm grateful to live in 2010. So I think a breast pump is great. Obviously, if the baby is doing well, we really still recommend trying to avoid the bottle the first 2 weeks. But there's all sorts of issues. I work a lot with preemies. These mothers aren't going to be nursing their babies sometimes for 4, 6, 7 weeks. How are they going to keep their milk up without a breast pump?
Let's end with one kind of controversial question. You hear these stories every once in a while of a woman breastfeeding a 5-year-old or breastfeeding a kindergarten student. When is it too much?
You know, that's a tough question to answer. And so what I generally tell people is that the World Health Organization recommends nursing till 2 years of age or longer if enjoyed by both mother and baby. And the American Academy of Pediatrics recommends nursing at least a year or longer if enjoyed by mother and baby. So when I tell people that, that really helps them to find, like I said, their upper limit.
Where can people go to find the best resources in their area?
Well, the best thing to do would be to log on to ILCA, which is the International Lactation Consultant Association.org website, and they have a list of board-certified lactation consultants in their areas.
Very important to ask for help. I'll tell you, my first baby was challenging. My second baby, I read all the books, I had all the classes, I had all the lactation consultant numbers, and it was a much, much better experience. So there's hope for anyone.
For sure.
Freda Rosenfeld, I want to thank you so much for sharing your tips with us and for doing such great work. And thank you for joining us for another episode of Health and Wellness. I'm Dr. Jennifer Ashton. Until next time, wishing you good health.